Hello future dentist, have you ever wondered how does a tooth actually move during the orthodontic treatment, and when we place braces, why does not the tooth simply fall out? What happens inside the periodontal ligament and bone? So today we are going to learn biology of tooth movement, one of the most important and frequently asked orthodontic topic in BDS exam. By the end of this video, you will understand pressure side changes, tension side changes, frontal resorption, hyalinization, undermining resorption, and effect of excessive orthodontic force. So grab your notes and let's begin. Suppose there was a tooth like this. So suppose this was tooth. Okay. So here when orthodontic force is applied to the tooth, so one side experience pressure. So this side will experience pressure and the opposite side, this side experience tension. Okay. So, and because of these two forces, the tooth start moving. So remember, on the pressure side, there will be a bone resorption. Okay. And on tension side, there will be a bone formation. So this is a basic concept of the pressure tension theory. Okay. Now we see the histology of the tooth movement, that is the changes on the pressure side. Okay, so we see first changes on the pressure side. So here when the light force is applied or within the physiological limit, so what does it mean? It means the orthodontist is using an ideal force, not too much and not too little. Okay, so here the periodontal ligament in the direction of the tooth movement get compressed. So its thickness become approximately 1/3 of its original thickness. So imagine pressing a sponge. So the sponge become thinner. Similarly, the PDL become compressed. Okay. So now second one is there is a marked increase in the vascularity. So why is increased blood supply important? Because the blood bring important cells to the area. So this increased blood supply help mobilizing the cells such as the fibroblasts and osteoclasts. So the most important cell here is the osteoclast. Okay. So which cell resorb the bone? Yes, the osteoclast. So here the osteoclasts are the bone resorbing cell that line up along the socket wall on the pressure side. Okay. Here the osteoclasts line up along the socket wall on the pressure side and they are now ready to remove the bone. So the resorption is seen in the alveolar bone plate immediately adjacent to the ligament. So in the diagram you can see this is a tooth and this is a tooth and this one is alveolar bone. So this was alveolar bone and osteoclast is arranged along the socket wall. So when an orthodontic force is applied to the tooth, so this side experience the pressure side and the opposite side, that is this side, experience the tension side. Okay, so here you see in the pressure side you will see, so here this is a periodontal ligament which is a normal side. So when the force is applied, okay, when the pressure is applied on the tooth, so this periodontal ligament get compressed to the 1/3. Okay, so this is, you see, this is compressed on the pressure side. So here and the osteoclasts will arrange along the socket wall. So these osteoclasts start resorbing the bone that is adjacent to the periodontal ligament. So this is a negative sign. It means here the bone resorption take place. So this type of bone resorption is called frontal resorption. Okay. Now changes on the tension side. So now let's move to the opposite side. So the area to the tooth opposite to the direction of the force is called the tension side. That is, this side we call the tension side. So here if pressure is on the one side, the opposite side become the tension side. Okay. So here on the application of the orthodontic force, the periodontal membrane on the tension side gets stretched. So you see clearly this is a normal side on the tension, but when tension side, the periodontal membrane becomes stretched as compared to the normal. So this becomes stretched. Okay. So think of a rubber band being pulled. So that is exactly what happened. Okay. So there is a raised vascularity is seen on the tension side just as on the pressure side. So does increased blood supply occur only on the pressure side? The answer is no. It occur on the both side. Okay. So here, this raised vascularity cause mobilization of cells such as the fibroblasts and osteoclasts in this area. Okay, so now pay attention. The pressure side, this pressure side has the osteoclast. Okay, and here this is a tension side which is having the osteoblast. Okay. So question for you, which cell form the bone? That is a osteoblast. Okay. So in response to this, osteoid is laid down by osteoblast in the periodontal ligament, which is adjacent to the lamina duration. And this slightly calcified bone is due course of time matures to form the movement bone. So here the osteoblast laid down, that is, the osteoblast is laid down by the osteoid tissue. What is osteoid? It is an immature bone matrix. Over time, this calcify and eventually form the movement bone. So remember, here the pressure side, there will be bone resorption, and in tension side, there will be bone formation. So you see, this is a positive sign. So it means here there will be bone formation take place. Okay. So tooth moving in one direction. So here pressure side will be causing the osteoclast activity. That means there is bone resorption take place. So there will be bone resorption, that is a minus you see. And in tension side there will be bone formation, that is a osteoblast activity. So this coordinated activity allows the smooth tooth movement. Okay. Now changes following application of the extreme force. So now let's discuss what happens when excessive force is applied. So question for you, if light force is good, then more force should be better. The answer is wrong. Heavy force create the problem. Okay. So whenever the extreme force are applied to teeth, it results in crushing or total compression of the periodontal ligament. Okay. So here the periodontal ligament becomes totally compressed. On the pressure side, the root closely approximate the laminar duration, compress the periodontal ligament and lead to the occlusion of the blood vessels. Okay. So here the diagram you can clearly see how it is totally compressed. On the pressure side, the periodontal ligament totally compressed as compared to the mild force where it is less compressed. That is a 1/3. Okay. So this is on the pressure side when heavy force is applied. So this ligament is hence derived of its nutrition supply, which is leading to the regressive changes called hyalinization. So here the ligament is deprived of nutrition supply. Since blood supply stop, the nutrition also stop. As a result, degenerative changes occur, and these changes are called hyalinization. So this is extremely important Viva question. Okay. So here the blood vessels become occluded, blood supply decrease, and the tissue begin to suffer. Okay. Now frontal resorption cannot occur. So in this case, the bone cannot resorb in the frontal portion which is adjacent to the teeth. Instead, there will be bone resorption occur in the marrow space and in alveolar plate below and behind above the hyalinization zone. So here you see, now there will be no frontal resorption take place. There will be whole resorption take place in the alveolar plate behind or above the hyalinization zone. Okay. So in this you see there will be only the negative sign. That means it all here the resorption occur in the adjacent marrow space and in the alveolar plate. Okay. So this kind of resorption is called the undermining resorption. So here the Viva question for you is difference between the frontal and the undermining resorption. So when light force is applied, there will be only frontal resorption. That means only this side there will be frontal resorption take place, which is adjacent to the periodontal ligament. But when the heavy force is applied, then there will be undermining resorption take place. That is whole resorption take place. Okay. So we see the tension side changes during the extreme force. So here on the tension side, the periodontal ligament get overstretched, which is leading to the tearing of the blood vessels and ischemia. Here the periodontal ligament get overstretched, and this causing the tearing of the blood vessel. So as a result, the ischemia occur and the osteoclastic activity will increase and there will be bone formation decrease. So this you see in this diagram how on compression of the periodontal ligament, there will be tearing. So there will be tearing. Okay. So thus, when extreme force is applied, there is network increase in osteoclast activity as compared to bone formation. So normally when mild force is applied, there will be bone formation take place. But in extreme force, there will be osteoclast activity, है ना? And with the result that tooth become loose in its socket. So there will be osteoclast activity instead of the osteoblast. So here the tooth become loose in its socket. So why does tooth mobility increase during the excessive orthodontic force? Because the bone resorption becomes greater than the bone formation. Now, here the patient may experience the pain, hyperemia of the gingiva due to the application of the extreme force during the orthodontic tooth movement. So patient may experience pain, gingival hyperemia and tooth mobility. And these signs indicate that the excessive force may have been applied. Okay. So before ending, answer this rapid fire question. Which cell resorb the bone? The answer is osteoclast. So you see there osteoclast. Okay. Now which cell form the bone? The answer is osteoblast. Bone formation with light force is called frontal resorption, and degeneration of period due to the heavy force is known as hyalinization. Now next question is bone formation with heavy force is known as undermining resorption, and bone form on tension side, where the bone form on tension side is known as movement bone. Okay, so that is a complete explanation of the biology of the tooth movement. If you are preparing for the BDS exam, make sure you remember pressure side means osteoclast plus frontal resorption, and tension side means osteoblast plus bone formation. So these two lines alone can help you answer many Viva questions. Okay, so thank you and keep watching Exam Key Point Dentistry for your exam.